Hello, I'm Dr. Michael Ches. I'm a pediatric epileptologist and neurologist in the Sacramento, California area. I was asked today to talk to you by the Lennox-Gastaut Foundation and talk to you about a drug known as Topiramate, which is a medication that's in other forms known in trade names as long-acting versions by different names such as Trokendi, and also has been known as Topamax in the past. There are multiple products of Topiramate, both liquid, tablet, and capsule. I won't go into that today, but I will talk to you about the basic drug and how it works. It hits multiple cellular targets, and it's been around over 20 years. It's proposed to be working at a sodium channel voltage gated type and a high voltage activated calcium channel and a GABA A receptor. It also may work at the AMPA kainate receptors, which work on glutamate, and also it may work on carbonic anhydrase isoenzymes. So it works in multiple mechanisms and is something that overlaps other drugs. It is very effective for migraine as well. Topiramate has some side effects, however. It can cause sedation, and many people feel at higher doses above 200 milligrams a day, and some people who are sensitive to even lower doses may find it harder to find words, harder to speak if they're trying to think quickly what they want to say, and they may feel mentally sluggish or slow if they're not used to the medication. Tingling in the hands and feet and dizziness can occur at dosages as low as 50 to 100 milligrams, and also because of the carbonic anhydrase effect, if you are sensitive to that, you might not at high doses sweat as much. And so therefore, if you live in a warm climate like we do in California, you might overheat by not sweating. So if you're a person prone to having trouble sweating on certain medications, you may want to be cautious with this. It also, because of the carbonic anhydrase inhibitor, may increase kidney stones, such as calcium carbonate stones and uric acid stones. So you may want to know that with the ketogenic diet as well, it will increase the risk of kidney stones because of increasing the acidity of the urine. It may also interfere with Depakote and increase the free Depakote levels and make it a little bit higher level in your body, so you might get a little more toxicity on Depakote. So you might want to either lower the Depakote or monitor levels when you use those in combination. Topiramate is effective for a broad mix of generalized and focal seizures. And like I said, it's also used for migraine. It does have FDA indication for Lennox-Gastaut syndrome based on studies that were performed to get approval back in the 90s. It's used to prevent migraine as a separate issue. And so if you have both migraine and seizures, this can be a good medication to use together. So overall, Topiramate is effective. It can help seizures such as convulsive seizures and drop attacks. It does have a lot of behavioral and cognitive side effects, and it has to be used cautiously as an add-on medicine, especially with drugs such as Depakote, which are commonly used in Lennox-Gastaut syndrome. And it can, with the ketogenic diet, increase the risk of kidney stones, and it can cause decreased sweating and overheating. So if you have all those issues in mind, you'll be able to safely use Topiramate if your doctor feels this would be a useful add-on therapy for your Lennox-Gastaut syndrome or other seizure disorders. I hope this was useful information for you, and thank you for listening.